Hi, I'm Janice Meeting.
And I'm Sierra Taylor Ornelas.
We have spent the last year together making a TV show called Rutherford Falls.
We've also spent the last year avoiding asking everyone, how are you?
Yeah, it's like, you know.
Yeah, pretty good, besides, you know.
There's no right answer, but it's so hard not to ask. Why can't I stop?
Luckily, answering this question is the only COVID-19 response we've been responsible for.
So we're very grateful for the work of everyone fighting the pandemic, and we're proud to present the COVID-19 Response Medal to Drs. Gary Gibbons and Eliseo Perez Estable of the National Institutes of Health.
I'm Dr. Gary Gibbons.
And I'm Dr. Eliseo Perez Estable.
Dr. Gary Gibbons and Dr. Eliseo Perez Estable have done incredibly important work to increase diversity in vaccine trials that have been incredibly important to the American people. Because COVID-19 has disproportionately affected racial and ethnic minorities across the U.S.
Gary and I came together when Dr. Collins, the NIH director, called us in to say, what are we going to do about these vaccine trials when 90% of the volunteers so far are white? And so we brainstormed. We got together every Saturday morning for about 3 months to strategize, to advise, to mobilize. And out of that came SEAL, this Community Engaged Alliance Against COVID.
This was a community-centered approach that leveraged long-standing partnerships in these communities of color and engaged local groups to be part of promoting participation in trials by trusted messengers.
In any scientific clinical study, we potentially leave questions on the table if we don't have diverse participation, because there may be differential responses to either medications or treatments, behavioral or otherwise, by different population groups. And race and ethnicity is one lens, but there's multiple others that we could apply.
Here in the U.S., we have a lot of different kinds of people who have a lot of different cultures, histories, and points of view.
Wow, you don't say.
I know. Even more surprising, these different people don't all get treated the same way by the institutions we rely on.
You're blowing my mind.
Typically, pharmaceutical companies reach out and include individuals who are the easiest to recruit. And unfortunately, that often neglects and leaves out communities of color.
There's a myth that minorities don't want to participate in research, that they distrust companies, government, science so much that they want to stay away from any of that. And that is just not true. There's been good research showing that that's not the case. The message has to be modified. The messenger has to be a trusted person, and it should be a local person. You need your local doctor and nurse to say, yeah, this is a good idea. Let's participate in this project.
It's critically important to promote participation in these trials within communities of color by meeting people where they are.
The model of community engagement and engaging them from the beginning in this process is a scientific approach that will help us answer some of these challenges.
It's so inspiring to see the work that Dr. Gibbons and Dr. Perez Estable are doing to include everyone in the fight and recovery from this pandemic. In mid-August of last year, Black and Latinx participants composed roughly 20% of Moderna's study. 2 months later, underrepresented groups made up 37% of these trials, with Latinx, Black people, and Asian Americans constituting 20%, 10%, and 4% of the participants, respectively.
That's huge. And we saw the same increase in the Johnson & Johnson trials. So, with Dr. Gibbons and Dr. Perez Estable giving so much to all of us, what can we give them?
This medal? We're literally giving them an award.
No, I mean, how can we help with their work?
Individuals can support our work by promoting trust in science. We look at evidence and data and make decisions. We're not always right. That's the nature of science. In the face of this pandemic, it has become magnified and so important to really take one step at a time scientifically to see how we can resolve the current crisis.
You got it. Hey, everyone, I trust science.
Me too.
Yay, we helped.
Congratulations, Dr. Gibbons and Dr. Perez Estable, for all of your incredible work.
Please welcome the Director of the National Institutes of Health, Dr. Francis Collins.
Good evening to all of you on this very special evening to celebrate public service. Before I go through what I'm supposed to be doing here is to give a citation about these two wonderful public servants. Let me just ask you all to give a big hand to the Partnership for Public Service and for Max Steyer. This is such a shot in the arm every year to all of us, if you'll pardon the use of that phrase in this particular pandemic. But it's a good shot in the arm, and we who are public servants are deeply grateful to the way in which this lifts our spirits and gives us a chance to cheer for some of our many heroes. Well, about these heroes. As leaders of the NIH Community Engagement Alliance, or SEAL, Drs. Gary Gibbons and Eliseo Perez-Estable used community outreach to address two crises, the COVID-19 pandemic and a lack of equity in our healthcare system. At the start of the pandemic, Black, Latino, and Indigenous populations were roughly 2 to 4 times more likely than whites to be hospitalized from COVID-19, and 2 to 3 times more likely to die from it. Yet members of these groups who have suffered from long-term health inequities were not reached out to participate in clinical trials and did not necessarily have opportunities to take advantage of vaccination programs once they were approved for emergency use. Gary and Eliseo saw a way to help by working with local organizations. One program empowered churches, doctors, community advocates, educational organizations, and other entities to be trusted messengers on vaccines and treatments. Another helped fund 53 projects across the country to make testing available to vulnerable populations. These efforts provided accurate medical information, built trust in communities, and made sure that medical advances like vaccines, treatments, and diagnostic tests were tested and shown to be safe and effective for underserved populations. So please join me in honoring Dr. Gary Gibbons and Dr. Eliseo Perez-Estable, the 2021 COVID-19 Response Medal winners.
Thank you. On behalf of both of us, it's an honor and deeply humbling to be recognized with the Sammy Award. First, we want to thank Eliseo and I, the Partnership for Public Service, for this recognition. We also want to thank Dr. Francis Collins, who challenged us and has been a stalwart supporter of our work and his leadership. Similarly, we wouldn't be standing here, quite frankly, if it wasn't for the hard work and dedication of the NIH staff who were critical to the NIH response to this pandemic. And certainly, as we've toiled through those Saturdays, we have to say how grateful we are to the love and support of our families who've supported us through as this NIH response to this public health crisis. Yet the real recognition is to those partners, those folks who are on the front lines, on the ground, working in communities and engaging them toward this work and their involvement in SEAL and the Radix Up program. Those partners, the community-based organizations, faith leaders, researchers who are dedicated every day to make a difference in these communities to keep them safe. Indeed, if those are the intrepid souls who literally went door to door during this pandemic to help keep their neighbors safe, trying to make a difference. And if there's anyone who really needs to be recognized for making a difference, it's really those on the front lines. And so We're thankful for them because that's really the public service at its finest. So we dedicate this award to those folks, our partners. Thank you.